A physician requests a laboratory test so that it would help him eventually in managing the patient. However, a good physician will only request for a laboratory test when he needs it and knows why they are requesting for the laboratory test. And that is our goal for this session. So just as a disclaimer, we are not going to run down all of the different laboratory tests. We're not going to run down where you collect these specimens, what particular vial you're going to put them in. We are not going to elaborate all of the different laboratory tests that are available in the different laboratories. We're not even going to talk about the normal value. So again, our point of discussion for today is hopefully you'll be able to be that astute physician who knows when to request a laboratory test and why you're requesting for the laboratory test. Whenever we're faced with a certain dilemma in a certain patient, we first get our history in PE. And before that, we try at least to get an idea of what is happening with our patient. However, sometimes we're still not 100% sure as to what's going on with our patient, how we're going to manage our patient, and that is where the laboratory test would come in. So what happens in a laboratory test is you have a pretest probability. The laboratory test hopefully will aid you to jump to that part wherein you can already make a decision as to the diagnosis and treatment of the patient. So the laboratory test will help you move forward in your management because you will be able to make a good decision based on this laboratory test. So we request a laboratory test to help us increase the probability of arriving at a correct diagnosis because from our pretest probability, it has already added to our confidence that we are indeed arriving at a correct definite conclusion. Secondly, we do a laboratory test to confirm our diagnosis, especially if our patient has a doubtful history or when the physical exam is not enough to conclusively reach a diagnosis. So for example, our patient is a stroke patient. You can't interview them fully, so maybe the laboratory test would indeed help us in ruling whether there is indeed a stroke, whether the stroke is due to a heart condition, or whether there are other underlying conditions which may help us determine why the clinical presentation is as such. Third, we also request a laboratory test to diagnose a certain condition, especially when these conditions are only defined by a laboratory value. So for example, anemia. We don't just say that a patient's anemic because the patient's feeling faint or the patient is pale, so the patient's already anemic. So it's not like that, no? We diagnose anemia based on a certain laboratory value, a certain laboratory cutoff in the CBC. And lastly, the laboratory test would eventually help us in selecting an appropriate treatment for our patient. However, please don't fall into the trap of requesting a laboratory test just because you don't want to do a history and physical exam. Remember, you only request for a laboratory when your history, when your physical exam is still not that conclusive on reaching a diagnosis. If the diagnosis is already obvious, you also do not request anymore a laboratory. So for example, the patient is presenting with blood in his stool. So will you still request for a fecal occult blood when the diagnosis is already so apparent? There is already blood in the stool, so you don't need further tests to tell you that that something is really happening with our patient. And lastly, you don't request for a lab just because it's free or it's part of a package. Because remember, someone else is always paying for that free laboratory. So always be conscientious in requesting for a laboratory exam. So what are the requirements when we are going to request for a lab exam? So first, of course, you need your patient. You first need a thorough history and physical exam. Why? Because remember, you only request for a laboratory when you have a suspicion, when you have a present working impression as to what's happening with the patient. Secondly, you also need to understand the pathophysiology and the epidemiology of this particular working impression. You don't go about, for example, you have a patient who has abdominal pain. Now, if the patient is young, would you say that, oh, most likely this is heart attack, most likely this is gastric cancer for someone who is young, when first of all, you know that these particular conditions, MI, gastric cancers, don't happen that often in this age group. So you must have a good working knowledge first of the pathophysiology of the disease that you are suspecting before you request for the laboratory. And lastly, you would need consent. So if the patient does not agree to having the lab done, then we can't really do much about that. No? Example, HIV tests. So if the patient does not request for that, even if it is so crucial to your diagnosis, still, we are bound by ethics. We cannot do the tests. So what is pictured here is the laboratory set up at the Philippine General Hospital, or the PGH. So of course, other hospitals might have a different laboratory setup. Now, I'm showing you this because this is how I try to remember whenever I try to order labs for my patients, no? So what I do is, first, imagine me. So that's the intern, Dr. T. And what I do first, of course, you go up the stairs. Then afterwards, first I drop off the things that I need to drop off at the blood bank because that is outside the laboratory area. Then afterwards, I go to the reception area where I log in the specimens that I'm bringing. And after that, since I'm always in a hurry, what I do is I go inside the laboratory area and I try to drop off the specimens myself at the different laboratory sections, no? So there's immunology, microscopy lab, the chemistry lab, the hematology lab, and the histopath laboratory, and also the microbiology section. Although personally, I don't usually go to the microbiology section because there are lots of infectious agents in there. And afterwards, if there is no Kuya guard at the end of the hallway, I go out of that door and then I go to the ABG section to drop off the ABG specimens. So let's just have a rundown of some of the common laboratory tests that we can require in the different sections of the laboratory. So here in the blood bank, these are the tests that we can request. So number one is a BT, or a blood typing, especially useful when we are going to transfuse blood products since we need them to be of the same blood type. Another thing that we can request for is a cross-matching. So this is a pre-transfusion testing. We test whether this particular unit of blood product is compatible with the recipient. And also we can request, this is where we can request for a Coombs test. So the Coombs test will test for autoantibodies present in the sample. The immunology and serology part of the laboratory is actually one of the sections wherein they have quite a number of tests, and between you and me, the most expensive as well. So some of the tests that we can request here in the immunology section are, first, the VDRL-RPR, which tests for syphilis. Also, the hepatitis profile, which tests for hepatitis A, hepatitis B, and hepatitis C, and the different serologies that are also needed in the determination of activity of hepatitis B. Troponin I, which is actually very frequently requested because it aids in the diagnosis of myocardial infarctions. The dengue tests, especially during the rainy season, and for patients presenting with thrombocytopenia, we usually request this one to check for the presence of antibodies and antigens actually in dengue. This is also where we can request for HIV, for ANA or anti-nuclear antibodies, specifically for cases of autoimmune disorders and lupus. And this is also where we can request for a rheumatoid factor, which is important in determining activity for rheumatoid arthritis and Sjogren syndrome. The TIFI-DOT or tests for Salmonella, this is also where we can request it in the immunology lab. This is a test for typhoid. CRP is a marker for inflammation. We can also request it here in the immunology lab. So while it is a marker of inflammation, it's actually not very specific. FDP or fibrin degradation products, D-dimer, we request it especially in assessing for the possibility of DIC or disseminated intravascular coagulation, and also for deep vein thrombosis and pulmonary embolism. ASO or anti-streptolysin O titers, we request it especially for those who present with sore throat because it might eventually lead to post-streptococcal glomerulonephritis. It is also at the immunology lab where we can request for the various tumor markers, and these are some of the more common tumor markers that we can request for. So first is AFP or alpha-fetoprotein, which we request for suspicion of liver cancer. PSA or the prostate-specific antigen for prostate cancer. CEA or carcinoembryonic antigen for colorectal cancer, and CA19-9, which is useful for pancreatic cancer. Now, one thing that we should be very careful of, especially in tumor markers, is they do not diagnose the malignancy. What it does is it can help in monitoring whether the malignancy is progressing or whether there are some worse features due to the presence or elevations of these tumor markers. The clinical microscopy section is also the section where we examine body fluids and all of the other fluids. So this is where we can do a request for a urinalysis to check for the characteristics of urine, which is important, especially in urinary tract infections, for urolithiasis, and for chronic kidney disease. This is also where we can request for a fecalysis or analysis of the stool, especially in gastroenteritis, for infectious diarrheas, or sometimes for malabsorption syndromes. You can also request for a fecal occult blood test or also a fecal immunochemical test to determine whether there is bleeding in the GI tract or whether there are malignancies which can be manifesting as bleeding in the GI tract. And also we can do drug testing here in the microscopy lab for the presence of drug metabolites, which is sometimes useful in determining as the cause to an encephalopathy, or sometimes as a government requirement. Like for example, when you're requesting for a driver's license, this is where you can have your drug test done. Other bodily fluids that we can test in the clinical microscopy section include the semen or a semenanalysis, especially in the workup of male infertility. This is also where we can do a pregnancy test or a Furning's test to determine whether or confirm whether the patient indeed is pregnant. And we can also send other bodily fluids for microscopic analysis such as cerebrospinal fluid or pleural fluid or ascitic fluid after a procedure. The clinical chemistry section, for me, actually is one of the more useful sections of a laboratory. So this is where we can request for our different electrolytes, sodium, potassium, chloride, calcium, blood urea nitrogen, creatinine. So this is where we can all request that. So the importance of the different electrolytes are as shown, and of course still you have to understand the pathophysiology of these particular electrolytes and the role that they play in health and disease. Like for example, potassium. Remember that potassium, especially if it's very high, can cause cardiac dysrhythmias, can cause electrical silence in the heart. So that is why measuring potassium is quite important. Calcium, on the other hand, is important also in certain disorders wherein the calcium can go up, like in bony metastasis of cancers, or in hyperparathyroidism, wherein the calcium can really elevate and can also cause cardiac dysrhythmias. BUN and creatinine are very important in the monitoring of kidney function, especially in chronic kidney disease and also in other conditions involving the kidneys. No? So remember that creatinine is supposed to be filtered out, supposed to go out. And if the creatinine goes up in blood, so that means that your kidneys are not working that well. That is why the creatinine goes up, which leads to a condition called azotemia. The liver enzymes ALT and AST would also give us a clue as to how the liver is functioning. So remember, if the liver is already destroyed, most likely it cannot already synthesize ALT and AST. Or if it is acutely damaged, then it ruptures out the liver, whereas the ALT and the AST can really go up because of its being released from hepatocytes. The alkaline phosphatase is very useful in determining whether there is blockage in the biliary system, because it tends to go up whenever there is blockage in the biliary system. The different bilirubins can also tell you, remember that it is the liver which is important in the synthesis of bilirubin, in the handling of bilirubin. So when it goes up, the patient can eventually have jaundice, and for us to determine whether the jaundice is coming from the liver itself or from a hemolytic process, then we can tend to look at the direct bilirubin, the indirect bilirubin fractions. The TPAG, or the total protein, albumin, and globulin, can give us a good estimate also of the functions of the liver, because remember, it is the liver that synthesizes albumin, and albumin and the level of albumin can actually tell us whether the liver is still working or whether it is diseased. FBS, or the fasting blood sugar, is one of the laboratories that we need for the diagnosis of diabetes mellitus. And the OGTT, it's one of the criteria that we can also use for the determination of diabetes, especially in pregnant patients. No? HbA1c would tell us whether the diabetes is indeed controlled, and we also do it here in the chemistry laboratory. The lipid profile is important, especially in the monitoring of the health status of our patients who have hypertension, have diabetes, and especially even in adults in general. No, it's a good idea for us to monitor their lipids, no, because it can eventually determine whether the patient will have atherosclerosis, which can lead to myocardial infarctions. LDH, or lactate dehydrogenase, is a test that we use to determine whether there is increased cellular turnover, such as in cases of hemolysis. So the procalcitonin is one of the newer tests actually that we have been requesting. So the procalcitonin elevates, especially in cases of sepsis. No? So at a certain range, when it's very much high, then we can say that most likely the patient is at risk for severe sepsis and septic shock. At above a certain level, it might tell you that the patient might have a small infection going on, and if it's low, then most likely the patient does not have an infection. So one of the things that we find this very useful is, for example, we have a patient with cancer who also has fever. So is the fever coming from an infection, or is it because of the cancer itself? So for example, when we do a procalcitonin and we find that the procalcitonin isn't that high, then most likely the fever is coming from malignancy and not really from an infection. BNP, or a brain natriuretic peptide, is also one of the newer tests that we can get to request. So it actually is a marker for heart failure, for chronic heart failure. Okay, now for my favorite section of the laboratory, I'm very much biased, the hematology section of the laboratory. So this is where we do our CBC, or our complete blood count. So this is where we can check for abnormalities such as anemias, leukemias, or certain other blood disorders. This is also where we do, or where I actually take a look at the peripheral smears, no? So to check also for other blood disorders, and also one of the more common blood disorders wherein we have to really check the peripheral smear is in malaria. This is also where we use it. This is also where we can do the ESR, or erythrocyte sedimentation rate, or a SED rate, to check for inflammation, although these are markers which are actually non-specific. The PT and PTT and the bleeding time, clotting time are tests that we use for determining of possible bleeding disorders, if there's liver disease, especially in prothrombin time, and patients who are on a vitamin K antagonist such as warfarin. So we have to monitor the pro time and also the INR, which is part of the results for pro time. So the bleeding time and clotting time, we use it as a global test for bleeding tendencies. The histopath section is most likely where you will find your anatomic pathologist. No? So this is where you get all the big tissue samples, the big tissue blocks, where they have to section them and put it under the microscope. So this is where they use it. And it's very, very, very important, especially in the diagnosis of malignancies and also for organ-specific disorders. This is also where immunohistochemical stains are done, especially in the workup of malignancies. The microbiology lab is where we can send our specimens if we are suspecting for an infection. So this is where we can do our culture and sensitivity of and the gram stain of the different specimens that we can send, like blood, like urine, like sputum. This is where we can send it so that we can let it try to grow and check whether it is susceptible to certain antibiotics. Also in the microbiology lab is where we do our AFB or acid-fast bacilli staining for tuberculosis. And also we do a KOH mount, which we use for fungal, when we are for testing for fungal infections. The microbiology lab is also where we stain the CSF with India ink preparation if we're suspecting for Cryptococcus infections. And also this is where we can send for a TB culture and sensitivity test to determine whether there is drug-resistant tuberculosis. So in current times, the microbiology lab has been in the spotlight because this is also where we can do our tests for COVID. When we have to do our tests, our nasal swab, our OPS, our oropharyngeal swab tests for COVID, this is also where we can send our specimens for them to run the PCR. So the EBG, or the arterial blood gas, is very much useful, especially for patients who have respiratory disease, to check for oxygenation status and also to check for acid-base balance, especially in patients with chronic kidney disease. So there are certain laboratories which we find not together with the usual laboratories because they involve the use of radionuclides. No, so it's at a separate part of the hospital complex, and these are the tests that we can do there, like TSH, T3, and T4. So these are tests for thyroid hormones, which are very much relevant if we're thinking of goiter or Graves' disease and in hyper and hypothyroid states. Thyroglobulin, this is also where we can do it, especially when we are thinking of thyroid cancer. This is also where we can do our serum ferritin and also PTH. No? And this is also where we can send for our other exams which involve hormones, no? Like prolactin, like catecholamines. This is where we can send our specimens for exams. So while not very much extensive, so these are some of the common tests that we can request in our laboratories. Now, the issue, especially with us as doctors, is when should we be requesting these laboratory tests? And also, when should we be requesting these particular tests? So these actually come with practice and also with having a very good understanding of the pathophysiology of the disease. So I'd like you to take a look at this list. And this list, although partial, tells us actually how much the laboratory tests cost. So if you see, no, we don't just request for a laboratory test left and right, and especially if you're kuripot like me, you really have to be to judge very well which of these laboratory tests you would need, which of these laboratory tests are the ones which our patients really need at this time. So this concludes our lecture for a guide to laboratory exams. So our next activity is trying to apply what we have learned previously in a real life patient encounter situation.